Hello dear colleagues. In this video, we will present a case who had type 1 macular neovascularization complicated with RPE tear and submacular hemorrhage. This case shared by Dr. Jiray Ursus, whose Instagram accounts are Aratina.Ursus and Aratina.Review. A 71-year-old male patient complained of decreased vision in his left eye for 3 months. At the first visit, his visual acuity was 20 to 100 in the left eye. He had mild cataract in both eyes. Color fundus photography shows macular elevation, yellow deposits, and hemorrhage. There is no sign of a retinal pigment epithelium tear on the autofluorescence image. OCT shows subretinal fluid and subretinal hyperreflective material, which are signs of exudative age-related macular degeneration. Pigment epithelial detachment and type 1 macular neovascularization also appear on OCT. Different OCT scans show risk factors for developing retinal pigment epithelium tears, such as high pigment epithelial detachment, corrugation of retinal pigment epithelium, and pretoroidal cleft. A retinal pigment epithelium tear developed after first aflibercept injection. Retinal pigment epithelium tear is breaking off the retinal pigment epithelium of a pigment epithelial detachment on one side and folding over on itself on the opposite side. A double layer of retinal pigment epithelium at the fovea does not cause decreased visual acuity, but if the area without retinal pigment epithelium includes the fovea, visual acuity is severely reduced. The visual acuity of this patient improved to 20/70 because the fovea was not affected by the absence of retinal pigment epithelium. The bare choroidal area, the area without retinal pigment epithelium, appears red on the color photograph and distinctly hyperautofluorescent on the autofluorescent image. On the foveal horizontal OCT scan, the retracted retinal pigment epithelium is seen as a dense hyperreflective tissue due to duplication of the retinal pigment epithelium and a shadowing effect beneath it. The OCT image scanning the inferior of the fovea depicts the absence of retinal pigment epithelium. In the absence of retinal pigment epithelium, the bare choroid area shows hyperreflectivity as a result of deeper penetration. Aflibercept injections were continued. On the day of the 5th aflibercept injection, visual acuity was still 20/70. Although the bare choroidal area cannot be distinguished on the color photograph, it is still distinctly hypoautofluorescent on the autofluorescent image. 2 days after 6th aflibercept injection, a massive submacular hemorrhage developed and the visual acuity of the patient decreased to hand motion. The patient underwent pneumatic subretinal hemorrhage displacement with intravitreal TPA and C3F8 gas. He remained in a prone position for 3 days after the operation. 2 days after pneumatic subretinal hemorrhage displacement, visual acuity increased to 20/70 again. The foveal hemorrhage had completely resolved and a significant portion of the macular hemorrhage had settled downward. 2 months after the procedure, visual acuity was still 20/70 and the hemorrhage was completely resolved. The foveal OCT shows duplicated RPE and absence of subretinal fluid. Aflibercept injections were continued under the treat and extend regimen.
You can share your interesting and educational cases on our website, retinara.org. Don't forget to click the like button and follow our channel to be informed about our new posts.